Audio Jungle.
Good morning. This is QTV News Platform. Health at a crossroads. Stakeholders demand political will for affordable care. Nigeria's health financing system is at a critical turning point. As experts say, without urgent reforms, millions of vulnerable citizens will continue to suffer under the weight of out-of-pocket expenses. At a high-level policy dialogue in Abuja, government officials and stakeholders made fresh commitments to strengthen universal health coverage and ensure affordable health care for all Nigerians by 2030. The report.
The National Health Financing Dialogue team, reimagining the future of health financing in Nigeria, brought together policymakers, development partners, civil society groups, and the private sector to take decisive steps toward expanding access to affordable healthcare. Minister of Health and Social Welfare, Professor Ali Pate, said the government is on a mission to save lives, reduce both physical and financial pain, and reach even the most vulnerable Nigerians. He warned that the country must not over-rely on foreign aid, insisting that sustainable domestic investment and private sector collaboration are critical to driving President Tinubu's health sector reforms.
For decades, we had not invested significantly or seriously in the health as we should have to get the healthcare system that we need. We spent probably $120 totally in terms of health spend. 2/3 of it is out of pocket. Barely $30 per person, if you add federal, state, local government, is what public contributes. And our developed partners contribute less than 10% of the total health spend. So the challenge is, with what we have at this point, how do we make use of it? How do we make it efficiently deployed? How do we mobilize efficiently? How do we purchase efficiently? If we can solve that or answer those questions, I believe we will begin to have a healthier health market that will see this country through this development phase as it grows and becomes a more prosperous country.
Supporting the call, Minister of State for Health, Dr. Isiaq Saloko, revealed that the federal government has raised health sector funding to 2.48 trillion naira in 2025, up from 434 billion naira in 2018. He, however, admitted that this still falls short of the 15% Abuja Declaration benchmark.
The ministry is already examining the possibility of approaching the National Assembly to increase the allocation of BHPF from the current 1% of consolidated revenue to at least 2%. A key deliverable of the Federal Ministry of Health and Social Welfare under the Presidential Performance Bond that we signed is to enroll at least 44 million Nigerians into the National Health Insurance by 2030 so that we can reduce out-of-pocket expenditure on health, which currently remains an acceptable rate of about 70%. We are committed to this target and will remain focused on strengthening this framework, enhancing their reach, and ensuring their sustainability, while addressing challenges such as inadequate budgetary allocations, systemic inefficiencies, fragmented programming, and dearth of reliable data.
On his part, Director General of the National Health Insurance Authority, Dr. Kelechi Ohiri, set a target of enrolling at least 44 million Nigerians into health insurance by 2030. He called on the media to play a stronger role in boosting awareness of the program, stressing that with 70% of health expenses still paid out of pocket, urgent action is needed.
It's a conversation. This is a place where government will share what it is doing. We'll also hear from other stakeholders. What can civil society do to amplify, to create better awareness, to create more accountability, so that the money that the government is spending has to go for the right things and has to go further along. It also means we bring in the private sector to look at what the private sector can do to support access to care. A lot of people go to the private sector, whether it is non-profit or faith-based organizations in Nigeria. They also have a role to play. We also want to understand what the states and local governments can do to add to this journey. so that every Nigerian is covered. So we can lay out what the federal government is doing, but we're also having conversations with the state and the local governments, and we're having conversations through a whole of government approach.
Civil society leaders and media representatives also in a panel session weighed in, drawing lessons from Ghana and Kenya, where innovative financing models have expanded insurance coverage and reduced financial pressure on households.
In a way that you can take lessons learned and improve the project process. When you go to the Kenya, the example you also provided, it is in the own document that they have to and they must organize those public discussions.
Programs and contents that are going to go a long way in assisting, allowing citizens to participate. This feedback is key. Issues around developmental journalism, the traffic is two ways. We have to hear from people, at the same time people also need to hear from you.
Now, reimagining the future of health financing in Nigeria is cumbersome. It needs to be broken down, and it is the media, it is the health journalists that will do that and pass it to the public. We are going to interrogate those that are around to tell us the various aspects that will be good for public consumption. Yes, as the theme is, it may be understood by experts, but not to the mechanic, not to the carpenter and the market woman. And this is where
When it comes to health financing, I think there's some power dynamics involved. So we should stop reporting just what we think is the gaps to also, I don't want to put it this way, but massaging the egos of the people involved. If, for instance, government has done certain things, maybe it has increased TB funding by 2% or HIV funding, we can still outline it in the story, or we can still do stories outlining what government has done and what it can do better.
Across the board, stakeholders agree that political will, accountability, and multi-sector collaboration from federal to local government and from the private sector to civil society are essential to building a resilient health financing system that protects Nigeria's most vulnerable citizens and secures universal health coverage by 2030. With growing consensus and renewed commitments, experts say the task now is to move from dialogue to action, ensuring that no Nigeria is left behind in accessing quality healthcare. Vincent Okushi, QTV News.
Audio Jungle.